You have shoulder pain, neck pain, and you might even be getting headaches from it. The two culprits: stress and prolonged sitting. In this video, I'm going to show you how to get rid of that pain in minutes. Stay tuned. My name is Dr. Jon Saunders, and I don't want to waste any time. I want to get right to it. In this video, I'm going to show you how you can get rid of your shoulder, neck, and headaches in a matter of minutes. If you're new to my channel, I appreciate you tuning in, and all you're going to need for this video are your two hands. So find a comfortable position and let's get to it. We're going to start at the front and move slowly around to the back of the neck, hitting what I find the most tight muscles in patients I see in clinic every day. The first area we're going to start is the front of our neck. We're going to find the meaty part of the insertion of the sternocleidomastoid, or short for SCM. If you want a more in-depth video, just click up here. I have a very thorough one treating that whole muscle, but I want to start with this one because this is very commonly tight in most people and they don't even know it. So we're going to find the front. You're going to find it just above the clavicle, and I'm going to start on my left side. Pick the side that's worse or tight, or you can feel tenderness, and you're just going to slowly massage into it until you find a trigger point. I got one right there. So this, you might find a trigger point that causes some discomfort that shoots to the back of your head. It might shoot just underneath your finger. It could even cause some dizziness. Find it and put enough pressure to cause about a 5 out of 10 or a 6 out of 10 in discomfort. Don't go too hard, but you can massage it a bit. You want to hold that for about 15 seconds. For those that want a little bit extra release of the muscle, what you can do is you can slowly turn away and up to the opposite side while you're putting pressure. So again, let me demonstrate on the other side too. Find the insertion that's, again, it's the, oh, there's a really good one, just above the clavicle at the front of the neck. Find the spot, hold it for about 15 seconds, and if you want a bit more stretch, turn away and slowly come up. It's almost like you'll start to strip that insertion point. I hope you're doing this with me because you can work through this and do this. It takes you minutes a day, a few times a day, to give yourself a break from sitting behind your desk or to reduce a bit of stress. We're going to move on to the upper traps. These are the muscles that we get tense. We don't even know we're doing this until someone tells us to lower our shoulders. We're going to find, again, the very top. I can find them pretty easily in myself as well. Again, just put a little bit of pressure, 5 to 6 out of 10 in terms of pressure to cause, not too much discomfort, but enough. Again, this one's referring to up the back of my neck. For some of you, it might be just tender underneath the muscle, but it could refer either into the arm or up into the head and neck as well. That's okay. Find it, hold it for about 15 seconds. And for those, again, that want a bit of fascial release, what you can do is raise your arm up and lower it as you come back towards the neck. So we're going to raise our shoulder up, get to the end point or the belly of the muscle, and as we lower our shoulder, we're going to strip into our neck, and we can slightly bend our neck to the other side. Let me demonstrate on this side. Shoulder up, grab your two fingers. We slowly bring our shoulder down as we come towards our neck and bend away. Great job so far. We're going to move into the scalenes, or the side part of our neck. And for this one, this is going to be more of a fascial release. We're going to take our 2 or 3 fingers. We're going to bend our neck towards the affected side. We're going to start at the top. And all we're going to do as we bend away, we're going to pull down into the shoulder. This one, for some of you, will feel a significant amount of pressure or refer pain or even a bit of a headache. Now, if you're experiencing those things, that means these muscles need to be worked. So don't shy away, just maybe put a little bit less pressure. Let me go to the other side. Again, 2 or 3 fingers, bend towards the side, and as we laterally flex away, we're going to strip down with a little bit of force. And you can do this 3 to 5 passes. Another thing you can do is push your shoulder down or pull your shoulder down as you get to the end. You're going to create a great stretch when you do that. Again, last one. Slow. Pull your shoulder down and drop your shoulder. And you just feel right at the end. I felt all three of them. You know, I work on patients all day long, so this is what I'm telling you is what I do to myself and give to my patients as well to help them alleviate stress and the effects of sitting behind their desk. I got one more at the back. This one's an important one. This is going to affect your suboccipital muscles. We're actually going to do a trigger point, but we're also going to do some release on them. You're going to take 1 or 2 fingers. You're going to slide them down the back of your occiput or the back of your skull right into the meaty part. And this in itself, if you get to these little muscles, just circle around that area to find where those trigger points are, and again, put a little pressure. You can do both sides at once, or you can stick to one. When you find it, hold it for about 15 seconds. And for those that want a little bit more release, what you're going to do is you're going to find those areas. So we're going to come off, we're going to extend up, and all we're going to do as we find those trigger points, stay on them, and then slowly flex forward as you're pulling your fingers gently down about 1 inch. Again, we can extend up, find the trigger point, and come down. An alternative is to use one side only. So we're going to find the trigger point and we'll put some pressure on that. But what we'll do is we'll turn to the side. We can actually do both sides here. And what you're going to do is you're going to try to find the movement that causes, or that you feel is causing the best stripping or trigger point to that area. And again, how do you know that? Well, you should feel a little bit of discomfort. Again, don't push to a 10 out of 10. You're going to be sore if you do that. But anywhere between a 4 and a 6 is generally good for a trigger point or a muscle release technique to help you rid the tension in your neck, shoulders, and head in the comfort of your home. If you found this video helpful, I'd appreciate some support by giving me the thumbs up. If you're new to my channel, maybe you'll consider subscribing so you can be informed when I upload a new video. If you have any questions or comments, leave them below. If you'll notice on my channel, I try to answer every single one of your questions. If I forget occasionally or I miss one, I apologize, but I'll try my best to answer all of them. Thanks again for tuning in, and I can't wait to see you on my next video. Until then, stay well.